all make assumptions about things we don't know about, right? I think that's just human nature. But what I find particularly troublesome is when people encounter stigmatizing experiences from the healthcare system. And the reason I find that particularly bothersome is because we should know better and we should do better, right? When you've been trained and licensed to work as a doctor, nurse, pharmacist, dietitian, you name it, you know more than the general public about these conditions, and you know, and you should know that living with diabetes is not uniquely the fault of the individual. But when a stigmatizing comment is made by someone on their healthcare team, that has a particularly strong impact on people's lives and on their perception of themselves. I think there are steps we can make to pivot our current healthcare practice to be more patient-centered. It's easy for those in privileged positions to exaggerate the agency that people have. But when you've lived in the shoe, lived in the position of not having choice, that's a very different story. And so for me, that was probably the biggest aha moment of my entire life, was interacting with these people and realizing that the whole kind of foundation on which I kind of assumed the world operated was a very different world than the one in which these folks lived. And that's continued to permeate my approach to work, in a clinical sense as well as in a research sense.